This video is part 5 in our nerve entrapment series. I'm going to be specifically covering the C5-C6 nerve root, where it gets entrapped, why it gets entrapped, clinical signs, palpation, and how to effectively treat it. For those of you that don't know me, my name is Dr. Matt Maggio. I am a soft tissue injury treatment expert specifically for neck, shoulder, elbow, and wrist pain. My focus is on finding and fixing scar tissue and reducing inflammation from chronic injuries without the use of drugs, injections, or surgeries, which does lead to a significant increase in overall functioning and long-lasting pain relief. I am also the creator of the Peak Method and the founder of the Soft Tissue Treatment Revolution, where we teach overworked massage therapists a better treatment system that will allow you to cut your treatment times by at least 50% so you can stay healthy, avoid the dreaded burnout, and help a hell of a lot more people get out of pain. Nerve entrapments part 5, going to be specifically covering the C5-C6 nerve root. As I've talked about in prior trainings, what comes out for the nerve is actually the lower listed one. So specifically, we're going to be covering the C6 nerve and all the good stuff that it does, what it functions with, what happens when it really gets messed up and problems it can cause, and most importantly, how to find it and fix it so the client can feel a heck of a lot better and stay away from pain pills, injections, and surgeries, which only make things worse. If you haven't watched the other versions of this, you can go back. If you watch this on YouTube, I'll link it up top, and consuming it anywhere else, it'll be down in the description link below. Each one kind of builds up on one another, but you can also watch them separately, whatever works for you. So let's get into it. Motor function of the C6 nerve root. First thing it does is it has a strong bicep muscles, basically strong elbow flexion, flexing the bicep. Yes, strong bicep muscles. That's exactly what it means. It helps to flex the bicep. That's what that nerve helps to do. The next one it does is a weak wrist extension. So what is wrist extension? Basically this is wrist extension. So it's really strong for the bicep, kind of secondary into wrist extension. Another thing it does is a thing called tenodesis or tenodesis. I don't know how to say it. I'm not trying to be fancy here, but basically it's the ability to passively flex the fingers while in wrist flexion. So when the wrist is flexed, goes like that. Another thing it does is shoulder rotation, adduction, and abduction. So a lot of movements in the shoulder as well. So sensory function of the nerve. So the nerve is both a motor and a sensory nerve. And over here in this diagram, this is basically the whole distribution of the nerve and what it covers. You can see this is looking at it from the front with the palm facing you. It's going to be more on the lateral side, in through the forearm, down through the bicep, into the thumb, and into the second finger. And then you can also see it's on the back side here. It's going to be on the back side of the elbow going down there as well. A lot of that feeds into like some muscles that are part of the radial nerve distribution. We'll be covering radial nerve in other trainings down the road, but this is the area where that sensory problem is. And a lot of times when there is some pain and dysfunction in there, it can go to that area. You also might see it right back behind the neck as well, like deep into the shoulder blade, especially if there's some damage to the C5-C6 disc and the nerve root in there as well. So where does it get stuck? Same place nerve roots always get stuck, in between the scalenes, more specifically between the posterior and middle scalene. As the nerve comes out through the neck, it has to pierce its way to make it where it goes. And a lot of times it gets caught between the middle and the posterior scalene, not as much on the anterior scalene because the C6 kind of controls stuff more posterior into the shoulder blade, down the arm, and into the elbow and the wrist. Not going to be caught as much in between the anterior and middle scalene, but the scalenes is definitely where it likes to get caught. Why it gets stuck, same story every week in this. Number one is just poor and sustained postures. People spend way too much time sitting, not moving enough, looking down, staring at their phones, just being a blob of humanity. And over time, those muscles get overworked. They get constantly contracted. They don't get enough blood flow and oxygen, causes an issue to the brain. Brain says, hey, what's going on? Muscle says, hey, I need some help. Creates what's called hypoxia. And essentially the brain starts sending collagen there. It's immature collagen, builds up over time, gets bigger and bigger, starts in the muscles, then it spreads out, And over time, it gets stuck to the nerve. When it does that, it creates numbness, aching, burning, tension, and pain. Also, you're going to see it just with injury or trauma, car accident, a fall, whiplash, all that kind of stuff. And also you can see some issues in there as well. If there's like a past surgery, maybe they had something done in the neck or the shoulder and they might have nicked that nerve or caused some issues in there as well. But it's pretty much the same story why it gets stuck every single week. So common injuries associated with an entrapment of the C6 nerve. Remember, it comes between the C5 and C6 level. First one is just neck pain. And a lot of times this is just going to be localized neck pain right to the back side of the neck, kind of where I showed in that distribution chart there. A lot of times people will have like some deep and sharp and stabbing and aching pain like into the shoulder blade a lot. And we always think it's like a trap or a levator or a rhomboid problem. Most of the time, it's actually a C6 nerve distribution problem. Next one is going to be radicular pain. So radicular pain basically means it's working its way down from the neck, down into the shoulder, down to the arm, to the hand, to the fingers. It's going to follow that pattern like we drew out, maybe into the thumb and the first finger on the back part, or even on the back part of the arm, or in the front part here as well. Really look at that distribution, and as well as into the back of the neck. Next one's just going to be cervical radiculopathy. So basically what that means is when there's a problem right at the disc in the joint as well. The nerve starts there. And a lot of times if there's a damage to the disc, specifically a disc herniation, it can push some problems in there. And it's going to be most common. It's actually the most common area of a disc to get herniated. The 5-6 and 6-7 are the two most common herniated discs in the human body, really due to biomechanics, lousy posture. And a lot of times when a client has like cervical radiculopathy, the symptoms are going to be a lot worse when they're moving or they're doing things. A lot of times when they're just kind of sitting still or laying down, it's not too bad. But as soon as they start to move it and move it around, it actually can irritate that nerve root, that disc as well, and cause some problems. And then last one is just going to be neck stiffness itself. So basically what happens is when the nerve is compromised or there's a problem with the disc, all the muscles around there, they tighten up in this thing called protective tension. The idea behind protective tension is it wants to unload that area. It wants to unload the nervous system, because if there's a problem with your nervous system, there's going to be a problem with you. So your body will sacrifice a lot of things out there. So you might have a client that wakes up and they can't turn their head one day, or they feel like they slept on it wrong, or everything is just always tight. They always have a stiff neck. A lot of times there's an underlying entrapment of this nerve, as well as some damage to the disc. So how to find it? Palpation. Palpation is always key. And basically what happens is when nerves are healthy, they got about 15% of extra slack in them. You can go in and move them around. But basically what happens is when the nerve is stuck with that scar tissue, it doesn't bow how it should. So when we go in there and palpate, we're getting precise tension, and then we feel like a lack of bowing. And a lot of times there's going to be some hypertonic or just tight spastic muscles around that area. That's where that protective tension comes in as well. The way I like to palpate this is the client is laying on their back, facing up with their arm tucked behind. I covered an advanced palpation video in the other training, so go back and watch that. It's in the very first nerve root training. I was in the C5 nerve root. As we go through, you'll see the palpation. It's the same thing for 5, 6, 6, 7 as we go down. And a link to that video will be in the description below, or if you're watching this on YouTube, I've already linked it up top. So how to effectively treat it? I say this every training: slow, precise, and focused. When I covered some treatment demonstrations, once again, in that older video, we covered the idea of like getting in there just right and getting the right amount of depth, then tension. Basically, we want to feel that tissue slide. So when that nerve is compromised, we want to find it with our palpation, and we bow into it and we're like, oh, that doesn't really give where we are. That's what we should get and where we should treat. So what we do is we go just inferior to that, and then we put it in a shortened position. Then we're able to get in there with some depth, and then we back out a tiny bit, and then we take tension. As we do that, then we move the client through a full range of motion. As we're holding the muscle, we're forcing the nerve to go through. Now, a lot of novice and jackass providers out there will be like, yeah, it's just pin and stretch. No, when you pin and stretch, you're just jamming it in there and you're making it a lot worse. I think I get fired up about this on every single visit when it comes to treating the nerves. You got to be gentle with them. You don't want to have no more than about 3 to 5 treatment passes, because nerves are very sensitive. They're very temperamental. If you overtreat them and you beat the living hell out of them, it's going to cause a lot of problems. So you want to go slow, precise, focus, depth, back out, then tension, then feel the tissue slide. Do not be in a rush. Don't be in there beating the living crap out of it, because you're not going to do anything. It's just going to hurt like hell. And then your clients will be like, oh, that hurts, must be doing something. You're like, yeah, it must be doing something too. And all you're doing is jamming on the nerve and making it a hell of a lot worse, and nobody's getting better, and you're causing more damage than you should. And then lastly, when people do have these problems, especially in like the 5-6 and the 6-7, there's also a component of the disc problem in there as well, and the nerve root getting caught as well. So a lot of that's going to be proper load management. What is load management? Basically, in an injury, capacity is what the muscle can take. Load is what it does. When load exceeds capacity, that's when you have an injury. So what we give in our clinics to every one of our clients is we give this program called the Postural Transformation Program. Yeah, it sounds really cool what it is, but basically all it is just getting them to do basic shit like drinking water, going for a walk, laying down, watching their posture on their phones. Because basically what's going to happen is if you treat the client and they do really well, but then they go and do a bunch of stupid shit in between, look at their phone on their device, not moving, it's never going to get any better. You're just going to continue to spin your tires in the mud. So really managing this load and letting the client know they have a responsibility in between as well. They can't just come in and get treatment and then go do all that dumb shit in between. They're not going to get any better. So load management is very key in making sure that the treatment is being held and sustained. So that's all I got for you guys in the video. I appreciate you guys watching. If you like the video, share it with other providers out there that you know that are looking to do excellent work and they want to fix problems. Keep looking out for the rest of the videos in this series. They're going to be coming out over the next couple of weeks. I appreciate you guys watching, and I'll see you on the next one. Bye.